Okay, good morning everybody. So as we know, this class is going online, so I welcome all the students from other medical colleges also. And again a very good morning to all of them also, and most welcome to this class. As the slide tells you, I am Dr. Suhail, professor in physiology, and we'll be discussing today about one of the topics from cardiovascular physiology, and that particular topic is titled as Conduction System of Heart. As a brief recall, we were discussing in our previous classes also about the different properties of cardiac muscles, and to have a brief recall, we know that the important properties of cardiac muscles, as you can see on the slide, they are autorhythmicity, excitability, conductivity, and contractility. So today we will be discussing particularly about this conductivity part. So we will be discussing about this conductivity part, which is the ability to conduct excitation through the cardiac tissue, also called as a property of dromotropy, right? Now, apart from this, also one more important property of the cardiac muscle cell is this autorhythmicity. And what is this autorhythmicity? Autorhythmicity means there are two parts to it, automaticity and rhythmicity. So automaticity it means the ability of the cell to undergo depolarization, spontaneously causing the production of electrical impulses. And the second one is the rhythmicity, that means that spontaneous depolarization occurs at regular intervals. So heart muscle has this intrinsic property of self-excitability, means it doesn't require any external impulse to generate its own action potential. So that's a special property of heart muscle cells called automaticity, and this impulse is not only self-generated, but it is generated at regular intervals of time, and that is what we call as rhythmicity. That is what we call as rhythmicity. Now coming to the heart muscle as a whole, we see the heart is more or less, it constitutes of cardiac muscle, cardiac musculature. And if we see the percentage of different types of muscle fibers in cardiac or in heart, we say 99% of the myocardium are these contractile fibers. So like atrial muscle fibers, ventricular muscle fibers, both contract same as in skeletal muscles, and duration of contraction is little bit longer than the skeletal muscles. So this is one part of the heart which, as you see, is the majority of the portion of the myocardium, and that is 99% of the myocardium is these contractile fibers. What today we are concerned about is this excitatory part, this excitatory and conductive muscle fibers, which are also having the property of autorhythmicity. This part, this specialized cells, what we call as specialized conduction cells of the heart, it forms only 1% of the cardiac musculature. So what are the special properties of these conductive muscle fibers? One is they have very few contractile fibrils. They possess very weak contraction, because their main property is to exhibit either automatic rhythmicity, or they also conduct the action potentials throughout the heart. So we are going to discuss today, in our previous classes we have discussed about the contractile excitability properties of cardiac muscle itself, which forms the 99% of the overall cardiac musculature. But today we will be discussing about this 1% of the specialized cells which forms the conduction system of the heart. Conduction system of the heart. So what is the property of these special cells? One, they can generate impulse. They are autorhythmic. They are autorhythmic. Second, they can conduct these impulses faster than the cardiac muscles. That 99% of cardiac muscles, they can also conduct. As we discussed, they have a special property called property of syncytium. They act as a single unit. Cardiac muscles, 99% of cardiac muscles, they can also conduct the impulse. But what is the specialty of these particular conduction system fibers? They can conduct it faster. They can conduct it faster than the surrounding cardiac muscle fibers. Okay, so these specialized cells form the conduction system of the heart, which have two important properties. One is autorhythmicity, second is faster conductivity, right? So let us move forward. So this is what I was telling you. The heart has a special system for generating rhythmical electrical impulses to cause rhythmical contraction, one property. Number two, conducting these impulses rapidly through the heart. So these are the two important properties of this conduction system of heart. Now what are the components of this conductive system? What forms the conduction system of the heart? So there are different components. As we all know, usually which is the pacemaker of the heart? SA node, cyanoatrial node. We say that is the pacemaker of the heart. It generates the impulse and that is then conducted to the other parts of the heart. So naturally that will form the first component of this conduction system of heart. So SA node is the component number one, and from SA node we go down to the internodal pathways, and then we have AV node, okay, and then we have AV bundle, and then we have right and left bundle, and then, okay, so this forms our conduction system of the heart. So these are the components of conduction system of the heart. As you can see in the diagram, I will show you more diagrams about that. You see here, SA node, it lies in the right atrium, right atrium. This SA node is connected to AV node. AV node is also in the right atrium, near the inferior part of interatrial septum. Interatrial septum, just on the right side towards the right atrium, at the inferior part lies the atrioventricular node or AV node. This SA node is connected to AV node by mainly these three tracts. These three, or you can call them internodal pathways, anterior, middle and posterior. We'll talk about them, what are the names and all. So here from AV node arises a bundle which is called bundle of His, and it pierces that non-conducting fibrous band which is present between atria and ventricles. You know already that there is a non-conducting fibrous tissue which separates atria from the ventricles. And this bundle of His, which arises from AV node, it pierces that non-conducting band and it reaches the tip of interventricular septum. It reaches the tip of interventricular septum and then it moves little down, and finally it's also called as AV bundle or bundle of His, and it divides into right bundle branch and left bundle branch along the interventricular septum, right? And then once these bundle branches, they reach the tip of the towards the apex, there they further branch into a huge network of Purkinje fibers, and they move upwards along the ventricular walls. The Purkinje network, it moves upwards towards the base of the heart along the ventricular walls. So these are the important components of conduction system of the heart. Every component, as I told you, has how many properties? Two properties. Every component of this conduction system. SA node, internodal pathways, AV node, AV bundle, right and left bundle branch, Okay, all these components have these two important properties. Property number one, autorhythmicity. Property number two, fast conductivity, rapid conduction. Okay. So this is a more elaborate diagrammatic representation of the conduction system of heart. You can see this is our SA node, cyanoatrial node, located in the right atrium, and then these internodal pathways connecting it to the AV node, and then this bundle of his arising from AV node, piercing this fibrous tissue, and then it reaches the tip of this is interventricular septum here, and at the tip of this interventricular septum, this bundle of his is divided into right bundle branch and left bundle branch, and then when they reach the apex, they are further divided into a network of Purkinje fibers. So this is our conduction system. Now, as I told you that all of these components have property of autorhythmicity. That means each and every component can generate an impulse on its own, automatic generating property. But SA node has the fastest rate of impulse generation. SA node has the fastest rate. As you can see, this diagrammatic representation, this is SA node, this is AV node, Purkinje fibers, and these are, what is the percentage of these fibers? 99% of the cardiac muscle fiber is these contractile fibers. Okay, so this is the conduction system of the heart, main components: SA node, AV node, and Purkinje system, Purkinje fibers. You can see here the fastest generating capacity is by the SA node. So you can say at about 70 miles per hour, and followed by AV node 50. You can say it is just representing like a train, but actually it is 70 beats per minute, 50 beats, and maybe 20 to 30 beats per minute. So naturally, the whole of the train or whole of the conduction system will follow the fastest generating component, fastest generating. So whole of the heart beats at the rate of SA nodal impulse generation rate, that is about 70 to 80 beats per minute. Because of some problem or because of some disease, if SA node doesn't perform, if SA node gets derailed, then the job of generating and conducting the impulse is taken over by AV node, and then AV node starts generating the impulse. Even if AV node stops performing, then Purkinje system will take over. But what will be the difference? Difference will be in the heart rate. Heart rate will be going on, slowing down. It will be slowing down, decreasing from, from 70 to 80 down to maybe, if Purkinje system is generating the impulse, it will generate only at the rate of 20 to 30 beats per minute. As you can see here, non-cyanoatrial nodal tissues. Which are non-cyanoatrial nodal tissues? AV node, bundle, these Purkinje fibers and all, are latent pacemakers that can take over at a slower rate should the normal pacemaker fail. So normal pacemaker is always SA node, cyanoatrial node. If because of some reason, if this fails, then these latent, why they are latent? Because they are quiet. When SA node is performing, these pacemakers are quiet, lying latent. They are lying latent. But when SA node fails, these pacemakers can take over. These pacemakers can take over. Okay, now coming to the cyanoatrial node, a little bit of anatomy about cyanoatrial node. Where is it located, and all those. So cyanoatrial node is the pacemaker, normal pacemaker of the heart, okay? And normally SA node is responsible for generating the electrical impulses that bring about the mechanical activity, that is contraction of the heart. As you know that there are two activities exhibited by heart muscle. One is electrical activity followed by mechanical activity. So first there will be generation and conduction of action potential, which will be followed by contraction and relaxation. So electrical activity is followed by mechanical activity. So SA node is responsible for generating this electrical impulse. And then SA node has the fastest rate of autorhythmicity. Now here one important thing that you have to note is that as we all know, if you recall the nerve supply of the heart, I have told you that heart is always under the parasympathetic influence. That is called a constant vagal tone. So this SA node is always under the influence of vagal tone or parasympathetic nerve supply. That tends to decrease its rate of generation of impulse. Otherwise, if you remove this vagal tone, if you remove this parasympathetic influence on SA node, the SA node on itself will beat faster than 100 beats per minute. So what I mean to say is that intrinsic impulse generation capacity of SA node is about 100 to 110 impulses or action potentials per minute. But in human body, under normal conditions, this SA node is always under a constant vagal influence. That is parasympathetic influence. That, as you know, parasympathetic supply, it decreases the heart rate. So that is why normal heart rate, normal performance of SA node is about 70 to 80 impulses per minute or 70 to 80 beats per minute. If we remove the vagal supply, then it can beat as fast as 100 beats per. That you have to keep in mind. Okay, location is SA node is a small ellipsoid strip of specialized cardiac muscle about 3 millimeter wide, 15 millimeter long, and 1 millimeter thick. And where is it located? It is located in the superior posterolateral wall of the right atrium, immediately below and slightly lateral to the opening of the superior vena cava. So the location is near the opening of the superior vena cava, obviously in the right atrium. Exactly where? Posterolateral wall, immediately below and lateral. Okay, immediately below and lateral. So it is located, suppose at the opening, lateral and below the opening of superior vena cava is the location of SA node, and these are the dimensions. So what are the dimensions? It is 15 long, 3 millimeter wide, and 1 millimeter thick. This is the anatomical location and dimensions of SA node. SA nodal fibers connect directly with the atrial. Okay, what is in the neighborhood of SA node? Atrial fibers, atrial musculature. Okay, so it lies in close contact with the atrial muscle fibers. So when SA node will generate the impulse, they will be quickly conducted to the atrial musculature. So now, once the SA node generates the impulse, what is the pathway of spread? How does this impulse spread? What are the directions of the impulse spread of impulse? So the cardiac impulse, after its origin in the SA node, spreads throughout the atrial muscle through two routes. So there are two routes by which SA nodal impulse is spread to the atria. As we know, this impulse cannot go to the ventricles directly because there is that non-conducting fibrous tissue between atria and ventricles that makes the heart as two electrical chambers. One is atrial chamber, one is ventricular chamber. The impulse can only go through some special pathway to the ventricles. Otherwise, this SA nodal impulse will not go directly to the ventricles. So this SA nodal impulse will only be spread to the atria. So how does it spread? One is that ordinary, as I told you, that ordinary, which is the 99% of the cardiac muscle, they can also conduct the impulse. Okay, they can also conduct the impulse. And because of the property of syncytium, all of the musculature, all the muscle fibers, they act as a single contractile unit. They act as a single contractile unit. So one pathway is that SA node generates the impulse and it is conducted to the whole of the atria through atrial muscle fibers. Second is through specialized anterior, middle and posterior internodal pathways. So as I showed in the diagram, there are three internodal pathways which connect SA node to the AV node. So impulse also goes through these three tracks to the AV node. What will be the difference in the conduction? In these two conductions, ordinary atrial muscle fiber and these internodal pathways, what will be the difference in conduction? Fastest conduction in internodal pathways. So these are the components of conduction system of heart. So they will be conducting the impulse faster. Also remember there is one anteriorly running band from right atrium to the left atrium. That is also a specialized band which runs along the anterior wall of the atria. That also spreads the impulse or conducts the impulse quickly from SA node to the left atrium, Apart from this normal atrial musculature, there is one specialized conducting band anteriorly that runs anteriorly through the anterior wall of the atria, which quickly takes the impulse to the left atrium. And as you see, there is no non-conduction band, no barrier between right and left atrium electrically. Although inside there is one septum, that is interatrial septum, but there is no electrical barrier between right and left atrium, so impulse generated by SA node gets conducted to the whole of the atria very quickly. And at the same time, the impulse is conducted very fastly through these three internodal tracts to the where? AV node, to AV node. Okay, coming to next slide. Okay, these are the names of these three nodes, internodal tracts. So what are the names? Anterior, the internodal tract which runs anteriorly from SA node to AV node is named as Bachman, tract of Bachman. Middle one is called as Wanke-Bach, and that one, the internodal tract which runs through the posterior atrial wall from SA node to AV node is called tract of Thorel. So tract of Bachman, Wanke-Bach and Thorel. What are these? These are the three internodal tracts, part of conduction system of the heart, running from SA node to AV node. If we can show you the diagram again here. So anterior internodal tract, middle internodal tract and posterior internodal tract, right? So anterior is Bachman, Wanke-Bach and Thorel. Coming to the velocity of conduction, in most atrial muscles, right? Conduction velocity in atrial muscle is how much? 0.3 meters per second. So naturally you expect the velocity of conduction in these internodal tract is bit faster than atrial muscle. So in specialized internodal pathways, the conduction velocity may reach up to 1 meter per second. Where? Internodal pathways, which run from SA node to AV node. Bachman, Wanke-Bach, Thorel. What is the conduction velocity? 1 meter, about 1 meter per second. What is the conduction velocity of surrounding atrial fibers? 0.3 meters. So way faster in these internodal, the conduction system components. Okay. The impulse after leaving SA node takes, now this is another question, how much time does this impulse take from SA node to reach the AV node? How much time? 0.03 seconds. So this is the time which is taken by the impulse to reach from SA node to the AV node. So once the SA node generates the impulse, it reaches the AV node within 0.03 seconds. Okay. Now impulse has been generated by SA node. It has spread all through the atria, right? And what will atria do? That will go into contraction. That's a different story. But by this time, the impulse reaches the AV node within 0.03 seconds normally. In case of conduction defects and all, this time may be more than usual, but normally it is 0.03 seconds that impulse reaches the AV node. Now what happens at AV node? The AV node is located in the posterior wall of the right atrium, immediately behind the tricuspid valve. Now again, SA node lies in the right atrium, AV node also lies in the right atrium, but at the bottom of the interatrial septum near the tricuspid opening, immediately behind the tricuspid valve, And what happens when the impulse reaches the AV node? It doesn't immediately go forward. So AV node holds this impulse for some time, and what it does is that due to the slow conduction in atrioventricular node, there is a delay of 0.09 seconds in the AV node before the impulse reaches the penetrating portion of AV bundle. You see what happens? AV node, from AV node arises the AV bundle, which is called bundle of His. That bundle pierces, what does it pierce? That non-conducting fibrous tissue, and it reaches the tip of intraventricular septum. So AV node, before it passes the impulse through the bundle of His to the ventricles, it delays this impulse by 0.09 seconds. So it holds the impulse, or there is a slower conduction through the AV node that takes about 0.09 seconds before the impulse can reach the bundle of His or AV bundle. Again, there is further delay of 0.0 seconds in the penetrating portion of AV bundle, the portion which is penetrating this non-conducting band. There also there is a little delay of 0.04 seconds. So what is the total delay? 9 plus 4, so 0.13 seconds, isn't it? 0.09 plus this another delay of 0.04. So 9 plus 4 is 0.13 seconds. So we can say total delay before the impulse crosses over to ventricles is 0.13 seconds. Actual AV nodal delay is 0.09 seconds. Is that clear? Okay. So total delay, as I told you, 0.13 seconds in the AV node, and that which part? Piercing part of AV bundle. Piercing part of AV bundle is total is 0.13. These values you must remember. You must remember all these values. And then this I told you already, there was a duration of impulse from SA node to AV node was 0.03. So this is the total time that is taken by the impulse to reach from SA node to tip of the ventricular septum. 0.13, you add, one is this, 0.09, 0.04, this adds up to 0.13, then add further 0.03, that takes from SA node to AV node. So how much is the total? 0.16 seconds. So once the SA node generates the impulse, it takes 0.16 seconds for the impulse to reach the tip of the intraventricular septum. Okay, is that clear? Okay, let's move forward. Now, what is the cause of this slow conduction in AV node? How does this AV node delay the conduction of the impulses? What can be the probable cause of slow conduction of impulse through AV node? So they say the cause of slow conduction is mainly because of diminished number of gap junctions between the successive cells in the conduction pathways. As you all know, gap junctions, they result in quick depolarization. Because of the gap junctions only, the cardiac muscle has a property of syncytium. So they say that in AV node, these number of gap junctions between the successive cells is lesser, very less as compared to the other parts of the conduction system. So that may be one of the important causes of a delay in the conduction from one cell to another. Okay? As a result of which, there is great resistance to conduction of excitatory ions from one conducting fiber to the next because of the paucity of gap junctions, because of the reduced number of gap junctions. Is that clear? Any problem in this? Okay. So as you know, gap junction, the property of gap junction is that it allows the free flow of ions between one cell and another. That results in quick spreading of the impulse or action potential. Now AV node has a diminished, very low number of gap junctions as compared to other parts of the conduction system. So that results in the delay which happens at AV node, right? Significance of AV delay. Why the nature has provided this mechanism that AV node should delay the impulse? Yes, because atria and ventricles, they need to contract in synchrony. Okay, if they contract together, it will not serve any purpose. So when atria is contracting, that time ventricle must relax. If both chambers are contracting, the blood has nowhere to go. So because of the SA nodal impulse, atria contracts, that time ventricle is relaxing and the blood goes to the ventricle. And this delay gives the time for ventricles to receive the blood, and after this delay of about 0.13 or 0.16 seconds, finally when the ventricle has received the blood, then it will contract because of the impulse that reaches the ventricle. So that is the significance of this AV nodal delay. The cardiac impulse does not travel from the atria to the ventricle too rapidly. This delay allows time for the atria to empty their blood into the ventricles before ventricular contraction begins. This increases the efficiency of the pumping action of the heart. It is primarily the AV node and its adjacent fibers that delay this transmission into the ventricle. So the purpose, the significance of AV nodal delay is to give the atria time to empty its contents, that is blood, into ventricles before ventricles can go into contraction. This is a diagram from Guyton and Hall textbook. So these are the internodal pathways, 3 internodal pathways. Can you quickly name them? Yes, what are the names of these pathways? Bachmann, Wenckebach and Thorel. And they come from where? What is there? SA node. So they come from SA node, goes to the AV node, and this is the bundle. This is the piercing part of the bundle. This is the non-conducting band. It lies between atria and ventricles, and this is the piercing part of the AV bundle, and finally it reaches the tip of the interventricular septum, and where it divides into right and left branch. So what is the time taken from here to here? 0.16 seconds. 0.16 seconds. And actual AV nodal delay is about 0.09 seconds. Now AV bundle, it arises from here, as you know, AV bundle. Now we are talking about this part, this atrioventricular bundle or bundle of His. So from the AV node arises a special conducting pathway called the bundle of His. Except for the very small part which is penetrating through the AV fibrous tissue and has low conduction velocity, the bundle of His is made up of Purkinje fibers which possess maximum conduction velocity of the heart. So what does it say? So it says that except this part, piercing part, this bundle of His portion and the bundle branches, and further it is divided into Purkinje fibers. This whole conduction system, these whole fibers, they are made up of Purkinje fibers. They are made up of Purkinje fibers. So what is the specialty of Purkinje fibers? They have the fastest conduction velocity, not rate of generation of impulse. Rate of generation of impulse is faster in SA node. I am talking about conduction velocity. Conduction velocity is fastest in Purkinje fibers. And Purkinje fibers, bundle of His, right and left bundle branches, and the Purkinje network in the ventricular walls. These are all made up of this Purkinje system of cells whose special property is that they have a very fast rate of conduction of impulses. And why nature has provided that? Why has nature provided ventricular system with this Purkinje fibers? Because one ventricular muscle mass is huge as compared to atria, ventricular muscle mass is huge. And second thing, ventricles contract, the stroke volume, the cardiac output is because of the contraction of ventricles. So ventricular contraction has to be very efficient and it has to be very quick. The ventricular muscles need to contract in a one swift contraction. One that is provided by one is the property of syncytium, right? It acts as a single muscle unit. Second, this quick and efficient and forceful contraction within minimum time is possible because of this fastest conducting tissue in the heart, that is Purkinje system. You imagine that if the impulse travels slowly through this huge ventricular muscle mass, so maybe different components of the muscle can contract slowly one after another, that may not result in a one efficient forceful contraction. So that is why nature has provided the ventricular musculature with what we call as a Purkinje network of fibers, which are the specialized part of the specialized conduction system of heart, having the fast conduction velocity, so that this impulse, once it reaches the apex of the interventricular system, it within no time it goes quickly, spreads quickly through the ventricular muscle mass. How does it go? It goes from bundle of His to right and left bundle branches, reaches the apex of the heart, and from there it goes above, in the above direction through the ventricular valves and reaches the base of the heart, So what is the velocity? Velocity is, it can go up to 4 meters per second. What was the velocity of conduction in internodal fibers? 1. In atrial fibers, 0.3. So it is much faster than that. That is up to 4 meters per second. So conduction velocity of Purkinje fibers, the fastest conducting fibers in heart, 4 meters per second. Again, the cause of the rapid transmission in Purkinje fibers may be attributed to the gap junctions. In AV node, gap junctions were lesser in number. Here in Purkinje system, they will be more in number. Gap junctions at the intercalated discs between the successive. So we say very high level of permeability of gap junctions at the intercalated discs between the successive cells of Purkinje fibers. That can be the cause, one of the main causes of faster conduction between the successive Purkinje cells. Right? Is that clear? Okay. The rapid conduction through the Purkinje fibers ensures that different parts of ventricles are excited almost simultaneously. This greatly increases the efficiency of heart as a pump. This I told. Normally the bundle of His is the only conducting mass between the atria and ventricular musculature, and it transmits the cardiac impulses from AV node to the ventricles. As I told you, there is that non-conduction band between atria and ventricles. And if SA node generates an impulse, it cannot be conducted to the ventricles directly unless there is some specialized pathway. So that specialized pathway is provided by bundle of His or AV bundle, which penetrates this non-conducting tissue. So what I mean to say is that impulses generated by SA node can reach the ventricles only through atrioventricular bundle or bundle of His. There is no other normal pathway by which SA nodal impulses can be transmitted to AV node. Is that okay? So only pathway is this AV bundle, also called as bundle of His, through which SA nodal impulses can be transmitted to ventricles, from atria to ventricles. So if there is any conduction defect, any problem in this AV bundle, the SA nodal impulses are not going to reach ventricles. They are not going to reach ventricles. Now this bundle of His, it divides into right and left bundle branches, and the distal portion of the AV bundle passes downwards in the ventricular septum for 5 to 15 millimeters towards the apex of the heart, and then at the apex it divides into Purkinje network. Okay. Each branch spreads downwards towards the apex of the ventricle, progressively dividing into smaller branches. These branches in turn course sidewise around each ventricular chamber and back towards the base of the heart. Okay. So this is right bundle branch, left bundle branch. It is going down towards the apex, and from apex it moves above through the ventricular valves towards the base of the heart, the Purkinje network. The ends of Purkinje fibers penetrate about 1/3 of way into muscle mass and finally become continuous with cardiac muscle fibers. So these Purkinje fibers, they penetrate into the ventricular muscular mass and finally they merge with these cardiac muscle cells of the ventricles. Okay. So this is the diagrammatic representation. This green one is the Purkinje network and this red one is the cardiac muscle fibers. So this red muscle mass forms 99% of the cardiac musculature, and while these conduction system, it is only constitutes about 1% of the total muscle mass. Okay, so now time taken from by the impulse from where? From tip of the interventricular septum to the different parts of the conduction system. What was the time taken from SA node to ventricle? 0.16 seconds. Now let us see how much time it takes from tip of the interventricular septum to spread throughout the ventricular muscle mass. So from the time the cardiac impulse enters the bundle branches until it reaches the termination of Purkinje fibers, the total elapsed time average only 0.03 seconds. And this minimum time taken is because of fast conducting Purkinje system. Okay, so that is the importance of these Purkinje fibers. Only 0.03 seconds. So once the impulse reaches the ends of the Purkinje fibers, it is transmitted through the ventricular muscle mass by the ventricular muscle fibers themselves. And for transmission of the cardiac impulse from the endocardial surface to the epicardial surface requires another 0.03 seconds. Okay, now this impulse, once it goes through the Purkinje fibers, it first spreads through endocardium. That is the inner surface of the heart. From endocardium, the spread is outwards towards the epicardium. So again there, the impulse takes another 0.03 seconds to spread from endocardium to the outer part of the muscle wall, that is towards the epicardium, because ventricular muscle mass is very thick mass of tissue. So another 0.03 seconds are taken there. Okay? Thus the total time for transmission of cardiac impulse from the initial bundle branch to the last of the ventricular muscle fibers in the normal heart is about 0.0 seconds. Samajh gaye? So the total impulse time taken from tip of the interventricular septum, down the septum, apex, then towards the ventricular muscle endocardium, then from endocardium it spreads outwards towards the epicardium and towards the base of the heart. So total time taken is 0.06 seconds. So if we take the total time from SA node to interventricular septum to the last portion, that is the base of the heart, what is the total time taken? 0.16 seconds plus these 0.06 seconds. Total is 0.22 seconds. So total time taken for one impulse to spread from SA node to the last portion of the heart, that is towards the base of the heart, is normally, if there is no conduction problem. Normally in 0.22 seconds, the impulse spreads from SA node to the last fiber of the heart. Is that clear? Okay. Now these are the conduction velocities in the different parts of the conduction system or in different parts of the heart. So you can see here, SA node, what is the conduction velocity? 0.05. Atrial pathways, we said that it is 1 meter per second. AV node only 0 points because it has the slowest conduction. That is why it delays the impulse. AV nodal cells have the slowest conduction, about 0.03 meters per second. Bundle of His 1, Purkinje system 4, and ventricular and atrial muscles, that is 99% of the muscle mass, from 0.3 to 0.5. These are the conduction velocities of different components of conduction system. So fastest is Purkinje, slowest is AV nodal cells. Okay? This is the rate of conduction. Then this is the rate of generation of impulse. Fastest generating is SA node, slowest generation is Purkinje fibers. Purkinje fibers, slowest generation rate, around 20 to 30 impulses per minute, but fastest conduction. SA node, slowest conduction, but faster impulse generation, faster impulse. If SA node fails, AV node will take over. AV node will take over, but that time heart rate will be around 40 to 50. If AV node also fails, Purkinje system takes over. But that time again, the heart rate will be around 20 to 30. Heart rate will decrease, but the heart can still manage to pump blood. This is the diagrammatic representation of spread of impulse. So it starts from SA node, this purple color, you can say this is the spread of the impulse. It starts from SA node and it spreads to the atria first, both the atria, and from there it goes to through the AV node, it goes down the septum and it spreads from here to here, it goes down the septum, and then it spreads very quickly through the Purkinje system, the whole of the ventricles. Okay? So from here, it goes to atria, down the septum, the whole of the ventricles. So this is how, these are the components. Again, to have a quick review, SA node, 3 internodal pathways, AV node, bundle of His or AV bundle, right and left bundle branch blocks to the apex, and then the Purkinje network through the ventricular wall. So this is the total time in milliseconds. So this will be your 0.03, 0.09, 0.04, 0.03, or 30 milliseconds, 90 milliseconds, 40 milliseconds, 30 milliseconds, 30. Total time taking is 0.22 seconds, or you can say 220 milliseconds for the impulse from SA node to the last portion of the heart. And last portion of the heart to depolarize is the base of the heart. Is that okay? So there can be problem anywhere in the conduction problems that we discuss when we discuss about the conduction blocks. So that will be another class where we discuss about the conduction blocks. So quickly, I will not go through that because that's a different topic. Quickly here, just an applied part or clinical importance of this conduction system is that there can be blocks, there can be SA nodal block, SA node may fail to generate the impulse. In that case, AV node will take over. There can be AV nodal blocks, AV node, it gets blocked. What will happen? What will happen if AV node gets blocked? Even though SA node generates the impulse, it will not be transmitted to the ventricle. So again, there will be problem. SA node is functioning normally, it is generating the impulse, but once the impulse reaches the AV node is not transmitting the impulse to the ventricle. So that is called atrioventricular block. It has 3 types mainly. As I told you, we will discuss in the next class in detail. It has 3 types mainly: first degree heart block, second degree heart block, and third degree heart block. Now, how does they differ? How can we diagnose those heart blocks on ECG? Inshallah, we will be discussing that in our next class. Anything you want to ask about today's particular? If any doubts are there, if you want to ask, you can ask. Otherwise, we may conclude this session. Is that okay? Okay, thank you all for your patience hearing, and thank you all the students who are attending this class throughout the country. Thank you all, and we'll like to have you again and again. We'll like to conduct many more classes for the benefit of students, and I may convey the message that our students are also attending many of the classes that are being transmitted live, and we are getting tremendously benefited by this online system of classes, getting to know about many experts throughout the country of national and international repute. So this is a very, very wonderful system to be put in place. So I thank you all those who are running this system nationally, and I once again thank you, my beloved students. Thank you and have a good day. Thank you.